All right, so today we're going to talk about the Medicare enrollment periods, the initial enrollment period, general enrollment period, special enrollment period. We're talking about Part A, Part B, Part C's, Part D's, Medicare supplements, all the rest of it. So we'll talk about that for about 10 or 15 minutes. This is a live Q&A as well. Looks like I already got a bunch of questions there in chat. So if you got any questions about all things Medicare, or Medicaid, or Social Security retirement benefits, or disability benefits, or survivor benefits. If you're new to my channel, my name is Ed Weir. I've helped millions of people out with all of those things. I ran the third busiest Social Security office in the country. And I've taken hundreds of thousands of claims on all of that. So I know how the sausage is made and how to make sure you're getting everything you're entitled to. So make sure you subscribe and like and all that kind of good stuff. So let's go ahead and get started here. All right. So why it's all too confusing. I have no idea why they designed this system so confusing, but let's try to get through it here. So the Medicare enrollment period, if you do this wrong, so this is important. If you do this wrong, you just might be penalized for the rest of your life. If you're late, if you don't sign up for Part B when you're supposed to, you might not be able to do it till the following year, and you just might be penalized 10% for every 12 months you did not sign up when you should have. And that's 10% for every 12 months. So if you signed up 5 years late, that's 50%. You're like, well, 50% of what? 50% of your premium. So if you sign up 10 years late and the premium is $174, you're going to pay $174 plus another $174 for the rest of your life. And this also includes Part D. It's a different premium. It's a different penalty, 1% for every month you did not sign up. So it's very, very important that you sign up at the correct time. And it's equally important that you don't sign up if you don't need to sign up. So we'll get into all of those, considering it's about to begin probably the busiest annual enrollment period we've seen in probably day one, because there's so many changes for 2025. So let's get into all those. All right, so first we're talking about Medicare itself, Part A and Part B. Medicare Part A is zero premium, so they can't really charge you a penalty on zero premium because 10% of zero is still zero. But if you don't sign up for it when you're supposed to and you need it, then you're not going to have coverage during that time. We're predominantly talking about Medicare Part B in terms of the penalty. So when do you sign up? Is you have a 7-month period. So 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. So if you sign up within those times, basically you sign up and your Medicare Part A, Part B, and everything starts the following month. Okay. So that's the easy one when you turn 65. Another one is the general enrollment period. If for some reason you miss the initial one and you don't have a special enrollment period that we'll talk about here in a bit, then you have to wait until the general enrollment period. I get a lot of people that forget to sign up. They move overseas and then they come back. They come back in July when they're sick, but they can't get Medicare until January, February, March during the general enrollment period. And if you're signing up for the general enrollment period, then you're probably going to be penalized as well because you did not have a special enrollment period. So they changed the law several months ago, the regulation, in that before, if you signed up January, February, March, your Part B would start in July 1st. Not sure why they made that delay, but they finally got rid of that stupid delay. And if you sign up in January, your Medicare Part B starts next month, February. If you sign up February, it starts March. So it's a lot more logical. It's a good thing they changed that rule. All right. So what about the special enrollment period itself? So if you have a special enrollment period, it's predominantly because you have had health insurance from work. So here's how a lot of people waste money is they're told that when they turn 65, they have to sign up for Medicare. And then, this also includes if you're on disability. If you're on Social Security Disability, SSDI, Social Security Disability Insurance, not SSI, that's the welfare-based program, but SSDI, then when you are on it for 24 months, your Medicare essentially starts automatically the 25th month. So about a month or 2 or 3 before you hit the 24 months on disability, Medicare will send you your card automatically. But in terms of working, so if you're working, you or your spouse, and you have health insurance from current work, and your employer has 20 or more employees, then you do not have to sign up for Medicare. So the whole, internet myth you see out there, YouTubers and the rest saying it's mandatory, you have to sign up for 65, usually because they're, trying to sell you a Medicare plan or whatever the case may be. No, you do not have to sign up for Medicare at 65 if you have health insurance from your work or your spouse's work and you have 20 or more employees. And obviously, if you're happy with it, if you're not, if you do, but it's a terrible plan, high deductible, whatever like that, you can go ahead and sign up. And you do not notify, you do not have to notify Social Security. We used to get, again, I ran the third busiest Social Security office in the country. We get calls all the time, people coming in wasting their time. And, anyway, that's our job, is to help people out. But they waste their time by calling Social Security or waiting in line and says, I have health insurance work, so I just kind of FYI, I'm not going to sign up at 65. You do not have to do that. You do not have to call Social Security and say, hey, I'm not going to sign up for it at 65. If you are currently receiving your Social Security benefits, then you will. Because what happens if you're currently receiving your Social Security benefits, then Medicare will automatically sign you up for Part A and Part B about 100 days before you hit your 65th birthday. So if you're filed early for retirement benefit, 62, 63, 64, or whatever, about 100 days before you hit your 65th birthday, Medicare will send you the packet with the card in it, the Medicare You book, and all that kind of good stuff. And at that time, you have to keep Part A. Right? Can't get out of that unless you're paying a premium for Part A. Most people don't pay a premium for Part A. But in terms of Part B, if you have health insurance from current work, yours or spouse's, 20 or more employees, then you have to do something. Then you have to go ahead, and if you don't want it, you just go ahead and refuse it. It gives you instructions in the book how to, cancel Part B. And then when you decide later, this is when your special enrollment period comes in. 8 months later, a year later, 16 years later, 20 years later, you're 80 years old and you finally stop working, your spouse stops working, and you stop receiving health insurance from work. At that time, you're in a special enrollment period. So you have to fill out a couple of forms. One of them is the 40B and the L564. And the L564 you take down to your employer. If you've had multiple employers since you turned 65, then you have to get one from each, because what you have to do is prove that you have had health insurance from work since you turned 65. So your employer fills it out. You submit those two forms. One is the actual enrollment. One of them is to, avoid the penalty. You send those to Social Security. They go ahead and sign you up at 70, 80, 90, 100 years old, and you got no penalty whatsoever. Zero penalty. You just pay with the monthly premium like everybody else. One of the tricks is a reminder, I guess, is on the 40B. Some of the new forms have this, but on there's a big remark section. Make sure you put down there, please start my Part B, next month or 2 months from now or 3 months from now or whatever the case may be. And that way you're not paying for, health insurance from your work and, the Part B premium. So yeah, a lot of people miss that. And then Social Security has to call you up and it delays the whole thing, wanting to find out, when you're going to start it. So 40B 564, very, very easy to fill out. The 40B is just, name, the Social Security number, address, phone number, please start my Part B January 2025. And the 564, your employer, I'm sure, has filled out hundreds of those before. Very, very easy to fill those out. What about all the other stuff? Okay, so that covers the initial enrollment period, the general enrollment period, and the special enrollment period for Part A, Part B. There's also what's called the Medicare supplements, because Medicare Part A and Part B are great. You paid for them. But there's a lot of gaps. There's 3 gaps in Part A. There's 3 gaps in Part B. The big one in Part B is the 80%. So if you go to the doctor to have a $100,000 surgery, you have to pay 20% of that. So that's why people get either a Medicare Advantage plan or a Medicare supplement plan. And they have different special enrollment periods and general enrollment periods. The whole thing is crazy. For Medicare supplement, those are the plan N and G and F and all of those. Basically, the first month you have Part B. So whether it's at 65 or before 65 if you're disabled. Well, most people, unfortunately, in most states can't get a Medicare supplement if they're under 65. That needs to change. So contact your state insurance agency or politician. Let's get that changed. But anyway, so if you get your Part B, if you're 65, you just get your Part B, you have 6 months from that time to go ahead and sign up for a Medicare supplement plan. If you don't at that time, then you just might have to go through health underwriting. So if you don't get a Medicare supplement for those 6 months, you decide to do a Medicare Advantage. There's exceptions there. You can try the Medicare Advantage for 12 months and then switch to a Medicare supplement plan. But if you're on a Medicare Advantage or nothing for 2 or 3 or 4 years, for a Medicare supplement in most states, you'll have to go through health underwriting. So it's important, if you're going to choose a Medicare supplement, do it within 6 months of receiving your Part B. Again, receiving your Part B, not necessarily when you're 65. So if you were working and you stopped working at 75 and you just signed up for Part B, there you go. You have 6 months to go ahead and sign up for a Medicare supplement, anyone you want, that's available in your area, and there's no health underwriting whatsoever. There are also special enrollment periods for Medicare supplement plans. See, this whole thing is all confusing, and that's why I definitely recommend finding someone that will be able to help you out navigate all this and make sure you're making the right decision. And I have put together a team. So if you click on call, email there, I put together a team of Medicare people that can help you throughout the country. The QR code in the corner there, you can just click on that and then choose Medicare one-on-one help, and we'll find someone to help you out that's licensed and contracted in your area. All right, so for Medicare supplement special enrollment period, if you move from one state area to another one and you lose your Medicare Advantage plan because of a move, just might be able to get a Medicare supplement without health underwriting. Your plan closes. I put this in big bold capital letters because for 2025, there are major Medicare insurance companies out there that are just cutting 10% of their clients. 10% of the people that have their plans, they're just say, yeah, we're not making enough money from you and your particular area or your particular part of the state or whatever, and see ya, bye. So those people that are getting those letters that their plan is leaving them, you now have the opportunity to get a Medicare supplement plan if it's right for you. Some people, they can't afford it within their budget, but Medicare supplements, you don't have, the prior authorizations and the networks and all that stuff. If the doctor says you need X, Y, and Z, insurance company can't go in there and second guess it. So a lot of people like their Medicare supplement plans. So if you're losing your plan, you just might be able to get one without health underwriting. If you work past 65, again, as I just mentioned, if you're 75 years old and you just signed up for Part B because you were working for the past 10 years, then you have that special enrollment period, if that is the credible coverage from work. All right, so what about, and there's all kinds of different other little exceptions if you've lost assistance from the state, particular states, particular type of assistance. So there's all kinds of different exceptions to the exceptions. The regular viewers to my channel know there's exceptions to exceptions with all things Social Security, Medicare, Medicaid. What about Medicare Advantage itself? So the big one, the annual enrollment period is October 15th to December 7th. So that's when you can change your plan, your current plan, because remember, your plan is only good until December 31st. And people always say, no, I've had my same plan for 2 or 3 years. No, you've had, maybe I have the same card, the same company, but the plan details, everything under the hood could have just very well changed, and people don't realize it until they realize it, until something happens. So people just say, oh, I don't want to do anything. It takes about an hour to review my plan with someone. And so I just don't have an hour a year to take out. So I'll just go ahead and let it ride. That's what insurance companies want you to do. They downgrade your plan, and then they take that money and give benefits to new people and try to entice new people. So they upgrade other plans and they downgrade yours. And so they're hoping you don't check. And people that are smart check, they, say, oh, okay, I'll keep the same company, same zero premium, same doctor. I'll just upgrade to the newer plan. That's the way you do it. They're not going to do it automatically, upgrading you to a new or better plan if one is available in your area. So October 15th through December 7th is when you do that. When you change it during that time, the new plan starts January 1. So your current plan, whatever it is, same company or whatever, it pretty much just Cinderella's December 31st at midnight, and your new plan starts January 1st. And then there's also kind of an open enrollment period from January, February, March, where you can change it one time. And then there's all kinds of special enrollment periods. If you're receiving Medicare and Medicaid, you can change your plan several times a year. If you're receiving extra help with prescription drugs, you can save your plans. You can change your plan several times a year. If you move out of the service area, not necessarily out of the state, but out of that particular plan service area, then you change. So with Medicare Advantage, there's an unbelievable amount of special enrollment periods that you can change. It seems like, the government comes out with some emergency, like in Florida right now, there's definitely those people can change their plans. A lot of people can change their plans because of the hurricane coming through, but you get one part of the country that has a fire, a little bit of rain or something like that. The government says, oh, this is a special enrollment period. So it's interesting, all of the special enrollment periods people come up with. So this is it. So again, Part A, Part B, enrollment periods. You've got Medicare supplement, different type of enrollment periods. You got Medicare Advantage, different type of enrollment periods. And if you don't do all this thing correctly, then you get penalized, or you won't have coverage, or you won't have coverage in time. So it's important that everything is done correctly. And yes, I wish the whole system was a lot more easy to navigate and just a one-stop shop. But unfortunately, this is the system that we have to deal with right now. So you can click on that little QR code or email me and say, hey, Ed, I'm confused, frustrated, hate the system. What can you do to help? And we can see if we can help you out. All right, let's get into some questions here. So make sure you type your questions in the Q&A, and I've got about an hour, and we'll answer as many as we can. Does a married couple have to file taxes together? I don't do taxes. I never work for the IRS. Hi, my disabled adult child's dad, my ex, passed away. She is getting child and care benefits from him as am I as her caregiver. So she's not receiving child and care benefits. She's receiving disabled adult child benefits. You're receiving the child and care benefits. But does my benefit expire, or will I continue as long as she does get it? If she is getting it based on a disability, that is a disabled adult child benefit, that she became disabled before the age of 22, she will continue to get it. You will continue to get it as long as she continues to get it. If she's just receiving it just because she's under the age of 18, a minor, then when she turns 16, your child and care benefits will stop. Hers will stop when she turns 18, or unless she's still in high school, it'll essentially continue until she graduates high school, or 19 in 2 months. Hi, Ed. Thanks for all the info. You're welcome. You're welcome. Kim, I have Form 1763 to request to cancel Part B for December. I have a job. Insurance will end December. Do I mail form or take it to local office? I will reapply for Part B in December for January. Also, I will lose Part. Yeah, you won't lose Part A, because once you sign up for that, that's pretty much set. Yeah, so you can you've got that 1763. It's got a bunch of verbiage on there that you understand that if you don't have credible coverage, then you're going to be charged 10% for every 12-month period and all that. So how to do it? You can definitely mail it in there. You can actually fax it in there. If you fax it in there, it goes into a system called WorkTrack. It's a paperless system. Yes, Social Security, the government still does use faxes, but once you fax it, it goes into an electronic system, which, by the way, I helped design the internal Social Security paperless system. So I know it works. Whether the actual employees, the human beings, pull the material out there, pull the documentation out there and take action on it, that's an entirely different thing. But if you fax it in, the Social Security office will 100% get it. Or if you really, really want to take it down to the local office, you cannot set up an appointment for that. You just have to walk in, wait in line, walk in, and see if the person behind the window is nice enough, has time enough to go ahead and input it directly into the system while you're sitting there. Let's see, can we get a sneak peek abstract on the cause and effect if the commissioner and the House of Representatives give Social Security to Wall Street or Dow Jones Industrial? Yeah, I did one like that. I did. It's called the video is called Social Security Advantage. Because Medicare Advantage is essentially privatization of Medicare. So I did a video about a month, 2 months ago now, on Social Security Advantage. All those times you have an accident with your car or something like that, and you try to get your money. Yeah, think of that. So, and Social Security budget in terms of the over 1,500 office, 65,000 employees, their budget is under 1%. Yeah, I think if you give it over to Wall Street, I think the CEO of whatever company we give it to is probably going to take 10% off the top for himself, right? In the board of directors. So yeah. Um, Great conversation yesterday. Oh, Mike, yeah, but I couldn't find the employer proof of prior health insurance online. 564. Where do they sign it to? Yeah, just let me see here. I just had it pulled up. You just type in CMSL 564 and there it pops up. And let me go ahead and I will put it in the chat button right there. There it is. So just click on that and yep, and just go ahead and take it down to your employer. Oh, and he found it. All right. All right, let's see here. Oh, and I had to skip down. Okay, here we go. All right, Bonnie, I do pay $124 every month for years. Can I call someone to find out how to fix this? What do you pay $124 for? Is that we're talking about a Medicare supplement plan or something? Um, yeah, if you want to shop around, if you've had the same plan forever and ever, that's one thing. If you have a Medicare supplement, you can change your Medicare supplement 365 days of the year, the Medicare supplement F, G, or N, to a cheaper plan, or from a G to an N or an N to a G. You might have to go through health underwriting, you may not, depending on your state, but it's always good to see if you can save yourself some money. And you can click on that little QR code or email me and say, hey, I need help. Could you hook me up with someone that's licensed and contracted in my state to help me out? Jay, I'm 60 and started receiving disability. Medicare kicks in October. What other coverage should I grab? So I always recommend Medicare supplements, the N or the G. That way you don't have to deal with, it's just between you and your doctor. You don't have to deal with the insurance companies. But in most states, they don't make Medicare supplement plans. Companies provide those plans to people under 65. So your only option possibly is a Medicare Advantage plan. But it depends on your particular state. I know New York, you can. Some states, they make the Medicare supplement plans, provide them to people under 65, but they don't regulate how much they can charge. So they charge you like 2 or 3 or 4 times what everybody else pays. But when you hit 65, you can sign up for any plan and they can't deny you and they can't charge you more. So yeah, if you want help, click on the QR code, email me, and we can find someone to help you out, walk you through all your options. 100% free service, obviously. Hi, I have a Medicare Advantage going to change to SUP. Can I stay on Medicare until February 2026, then move to a SUP? Probably not, because I mean, there are special considerations, but most of the time, your Medicare Advantage plan is for 1 year, unless you move or something like that. If you move in, December, January, then that's a different situation. But if you're staying in the same place and you don't have some other special enrollment period that the broker can find, then your Medicare Advantage, once you sign up for the Medicare supplement, your Medicare Advantage ends December 31st, and they just won't renew it. Because again, all those plans are good for 1 year. So you're kind of stuck in those plans for 1 year unless you have a special enrollment period. I applied for both SSI and SSDI. Can I withdraw my Social Security SSI application now before a decision is made? And can I always decide to reapply for SSI a year later? Yeah, if you don't want SSI for whatever reason, SSI is, the welfare-based benefit. When you apply for disability, the Social Security employees is supposed to address both programs, SSDI and SSI. But if it looks like you might have some money coming in, or resources or something like that, then yeah, just tell them, yeah, I don't want SSI, no problem. And then if something changes in the future, absolutely. But if you're approved for SSDI and that benefit amount is this year over $943, then you're not eligible for SSI anyway, because you're making more than what you would receive on SSI. So if your SSDI is more than 943, then you've already been essentially denied. So just got here. Have you heard of a program that combines Medicare and Medicaid? Yep. And millions of people have Medicare and Medicaid. Talk about it all the time. So, yep. If you have Medicare and you're having problems, particularly paying that $174.70 Part B premium, you call up Medicaid, Department of Social Services, wherever you're at in your particular state, and you say, hey, pay for my Part B, help me out. And they'll take an application for Medicaid. Again, it's a welfare-based program, so needs, means tested, income, resources. And if you're approved, then they pay for your Part B premium. It depends on what level you're approved for Medicaid. It's called the Medicare Savings Program. And then if you have Medicare, Medicaid, you're also having the extra help with the prescription drugs, and you can sign up for a Medicare Advantage dual eligible plan. That's definitely the one. You can't sign up for a Medicare supplement if you have both Medicare and Medicaid, but you can do a Medicare Advantage dual eligible plan and get probably more benefits, and depends on what's available in your area, but absolutely. I have Medicare Advantage and Tribal. I mainly use Tribal. Do I have to carry Medicare? You don't have to do anything. Some people, I've signed people up that use Tribal hospitals and stuff, and they want to have kind of a fallback position. And so they go ahead and sign up for Medicare, but they hate paying for that $174.70. So what they do is they sign up for what's called a Medicare Advantage Part B give back. And the Part B give back, depending on your particular area, pays for all or part of your Part B. So you kind of get your cake and eat it too, right? So you get your Medicare paid for, but you have other options to go. Usually the people I talk to, or they need more dental or vision or something like that, or they maybe want a second opinion, so they want to have that as kind of a fallback. So if you want to see if one of those Medicare Advantage Part B gives back is available in your area, check on that little QR code or email me, and we'll find someone to help you out. When you sign up on your spouse Social Security, you get yours and 50% of theirs. She's 67. Yeah, up to 50. It doesn't matter when she is. If you're the spouse signing up on the higher, she's the higher earning, then you get up to 50% of her benefit amount if you are your full retirement age. Yep. Cheryl, I am on Medicare Advantage, going to switch to a sup plan. Can I stay on Medicare Advantage? Okay, we already answered that one. Hard to determine which. Yeah. All right. Because of Social Security, my food benefits were cut to $237 a month. Who can survive on $237 a month with today's food cost? Yeah, it's interesting that when the colas come out, people are like 8.7% cola. I don't think it's definitely not going to be that this 2025. We don't know yet, but some people hate colas because they're just at the border for Medicaid or whatever the case may be, and if they make $1 or $2 more, then they get kicked off Medicaid. So when they see the cola coming out and they're like, "Oh my gosh, that's terrible! It's 3.2% next year." Oh, then they're like, "I get an extra $75 of my Social Security check, but I lose $300 a month because I lost Medicaid and those extra Medicare Advantage dual eligible benefits, the food card, and all that kind of stuff." So yeah, I know exactly how you feel. I've seen it happen way too many times. But make sure you check out the video I did, the one on the bottom, how to live on Social Security alone. I did a 4-part series on that when I was new to YouTube, and introduction was too long. But anyway, all all my talking is always too long, so I'm not for everybody. Anyway, but I did a shorter version, a quicker version. So check out that video, how to live on Social Security alone. Just go to my YouTube webpage and you'll see it there. And it'll has close to 50 different programs that might make your life a bit easier. So make sure you check out those. All right, let's see. All right, other questions here. Kim, will I still need the Form L65 if I will still be in the enrollment period? No, if you're still in that 8-month enrollment period, then or the 7-month enrollment period, then you should be good. You won't be penalized. When I worked at the Budget Rent a Car, they always spoke about how enterprise rentals are private and as profitable as SSI not being on. Yes, yeah, I'm not sure what that means. All right, are you doing advertising for rental car places? All right. Have people having conversations here, which is awesome. Be thankful that there's even a program to get anything. You can go away anytime. Yeah. Yeah. I wish that actually the commissioner of Social Security was asked recently in a congressional hearing on insolvency. And if you want to figure out which political party wants to solve the issue of Social Security being in the future, still being here in the future for us and our kids and our grandkids, watch that testimony and the questions each political representative asks, and you can immediately see who wants to privatize it, who doesn't care, and people that actually have a plan. So it's enlightening. But the commissioner was asked about that. It's like, okay, if for any program, SSI, the prescription extra help or something like that, if people make $1 over that, then the entire thing is negated. The entire thing is, done, canceled. And he was asked, well, is there any way you can kind of moderate that a bit and say, okay, if you make, a dollar over, $10 over, $20 over, we won't cut it 100%. We'll cut it, 70% or 50% or 40% or something like that. So he was asked that question. And so hopefully something along like that happens. Yeah, because it hurts for a lot of people. Yeah, I just saw the COLA for a Social Security at 3.2 on the SSI website. Yeah, that's for this year. Also, even though I'm delaying my benefits till next year at 66, will that already be included? Yes. People ask all the time, well, did my Social Security include COLA? Yes. The computer system, when the COLA is announced, the computer system goes into the 70 million records and automatically does the COLA. And even if you're not receiving benefits, then the COLA is added in there on your estimate when you go on to ssa.gov. So everybody gets the COLA. You don't have to ask for it. You don't have to, research it. It just comes. There's always local food banks, community kitchens for help with food. Yes, yes, always. Lori, is it possible to pay Part B premium for the whole year instead of monthly to get it out of the way? No. Yeah. Well, I mean, you get if you're not receiving Social Security benefits right now, then you're billed quarterly. There is a way to set up online to where you can just get it, taken out immediately from your, account, and you don't have to deal with it. But normally, it's a 3-month thing. I guess I don't know if anybody. I guess you could pay it for the whole year, and they would just credit. It'd be a credit on your system, but on the system. But I've seen some of those kickback that you have an underpayment that you're owed money, and so I probably wouldn't, because it's gonna the Social Security system, the computer system, which talks to Medicare, it's based on 1970s technology. They're upgrading, a little bit, but yeah, that's an advanced thing I wouldn't necessarily trust. I was told this year, had insurance through my husband's work. They told me I would be penalized and how to cancel my current insurance. Ugh, I now pay so much more on Medicare and prescription with Plan N. Yeah, I'm not sure why they didn't think your husband's work, unless your husband's work did not have 20 or more employees. That's the only case. If not, then you were given incorrect information, unfortunately. Medicare, Medicaid has enrollment periods based on natural disaster. Not Medicare and Medicaid, but the Medicare Advantage plans and predominantly have natural disaster type things. Yeah. And you think natural disaster, you think, San Francisco earthquake or something like that. But no, it's 2 inches extra rain in this particular pace. And yeah, it's I don't know where they come up with these natural disasters. You're like, yeah, rain a little bit more. Oh, there's a special enrollment period. It's crazy. Yeah. Would there be any benefit to wait on filing in Florida after rather than Alabama. No, in terms of Medicare Part A, Part B, doesn't matter where you live. It's all the same. It's a national program. There is a for Medicare Advantage and Medicare supplements, yes. Medicare supplements based on the state, Medicare Advantage based on your particular zip code. So, yeah, if you're going to be starting, you're 65, but you're currently in Alabama and you're going to move to Florida, then yeah, wait till move to Florida. And again, make sure you don't miss your initial enrollment period. You might have to. Some people have to go ahead and sign up for everything Medicare Advantage for 2 months where they're at, and then they have to sign up again when they move to a new area, or Medicare supplement, whatever the case may be. So make sure you don't miss and get charged extra. I applied for both SSI and SSDI. Okay, already answered that one. Illegal aliens are sucking up our benefits. That is 100% correct. If you are not here legally, you cannot get Social Security, retirement, disability, survivor benefits, SSI. You have to have legal status in this country to get those benefits. And people say, well, they have this refugee. Well, Congress has determined those are in the country legally. You might disagree with it, but they have their green card showing their legal status in the country. So that is another internet myth of those people that want to get rid of Social Security. So they start this, magician type distraction. Oh, look over here. All the money's being given over here. And then you don't focus on the real issue. And then your Social Security gets cut 20% in a few years because you were focused on the wrong thing. So Canadian, hey, what's up? Husband passed and was on disability. Our son is on disability. I think you answered this question. You asked this question yesterday and the day before yesterday. Yeah. All right. Yeah. So let's see here. I read that a lot of hospitals are now refusing Medicare Advantage plan. Yes, baby crab cakes, and I'm doing a video tomorrow about that. Yes, that is an unfortunate one. Yeah, people sign up for those Medicare Advantage plans, and again, I wish there's a better system, but some people just can't afford, Medicare supplement, the extra monthly premium, so they get a Medicare Advantage with the zero premiums. But remember, Medicare Advantage didn't always have those zero premiums. 10 years or so ago, there was a monthly premium for them. And will there be another monthly premium 5 years from now, 10 years from now? And by that time, you won't be able to get a Medicare supplement because of your age or your health or whatever the case may be. So, yeah. And doctors and hospitals are dropping them. So, yeah, we really need to do something about the whole system. I turned 65 in February. When do I apply for Medicare? Yep, about 3 months before you turn 65, unless you're already receiving Social Security benefits. And then if you are already receiving Social Security benefits, you don't have to do anything. You'll get your Medicare Part A and Part B in the mail. But if you're not receiving Social Security benefits, then yeah, about 3 months before you can file online, and you can restrict your application. So you can say, I just want Part A because I have health insurance from work, my spouses or me. I just want Part A. Or I just want Part A and my money to start. Or I want Part A and Part B and no money start. I'm waiting until I'm 68 or 69 or 70. Or you want all three, Part A, Part B, and your money. So you can do those choices. Denise, thank you very much. You're welcome. I started receiving Social Security only a few months ago. I also received 6 months of Social Security back pay, which amounted to close to $7,000. All right. So I wonder if that was, your disability was approved or something like that. If my ex remarried and divorced her, now has passed away, can I claim on his Social Security, or does the other ex have the right? The other ex has the right, but so do you. You can have 3, 4, 5, 6, 10 ex-spouses receiving benefits on the same account, the same record. And one doesn't affect the other. Could you imagine if Social Security did that, where it's like ex-spouses, as soon as another ex-spouse comes on, all the other ex-spouses' benefits are reduced? Could you imagine the chaos and turmoil that would happen? Yeah. Oh my gosh. You have a green background with nothing on it. Yes, I do. Yeah, it's for my TikTok is I'm on TikTok on this other thing, but TikTok kind of sucks. So come over to YouTube, where it's not a green screen. Anyway, Social Security told me I can't switch to collect from my ex because he didn't receive 50% more of what I get. Yep, that is correct. If that person is still alive and kicking, that person's benefit amount has to be twice your benefit amount. I've been on disability Social Security for years and SSDI just changed. Not sure what the change is. Let's see. Has the retirement age increased? Yeah, next year it's going to finally tap out. Anybody that was born 1960 and over, their full retirement age is 67. But if you watch that congressional hearing, you can see that some parts of the political spectrum want to increase the retirement age, and that's what they're talking about. And the other, me included, believe the retirement age shouldn't be increased. There's other better options to shore up Social Security for the future. Can I have an MA plan and a health plan as a retirement benefit from former employer? Some former employers actually so if you see, like the old days, if you have like a retirement, if you work for a company for 50 years, you get your gold watch and they give you a retirement, a pension, and which doesn't happen very often anymore. And they also give you health benefits for the rest of your life. And that's becoming more expensive to them. So what they're doing is they're switching to Medicare Advantage plans, so they save a lot of money, and you have to go through so some people have their actual retirement plan is a Medicare Advantage plan. So yes, I will reach my full retirement age of 66 and 10 months in March 2026. Can I get part of my ex-husband's Social Security benefits? Yeah, if that benefit is twice your benefit amount and that person is at least 62 years old. If my ex remarried, okay, there we go. Yep, so I already answered that one. Let's see here. Tony, I wish the Social Security system would let you upload your records and any paperwork with your Social Security account, like VA disability claims. Yeah, they can. If you are like have a pending disability claim or something like that, then all you do is talk to your disability examiner, the person at the DDS, Disability Decision Service, and they will give you like a scan code, a sheet of paper, and it's kind of a cover sheet, and then you can scan it into your EDCS. It's called eView, the Electronic Disability Control System. Yes, you can do that, but that's only basically if you have a pending claim. All right, let's see here. Will Medicare changes affect the plans that are already available, or will there be more plans available? Yes and yes. Are there more costly premium charges for prescriptions? Probably yes. Yeah, this is going to be the biggest Medicare Advantage season, yeah, in many, 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 many years, because of the new regulations on Medicare Advantage plans that they have to start, telling people that hey, you've got extra benefits that, we're getting money for, so you should actually use those. And that's people start using their benefits, and that's going to cost the Medicare Advantage plans more. There's a lot more regulations. There was the $2,000 prescription drug max out of pocket. So all of those things have a ripple effect on probably all plans for 2025. So yes, the ones that you have right now, your plan is only good for another 3 months. Your plan goes bye-bye December 31st. And then a new plan starts January 1st. You might have the same card and the same company and the same zero, premium per month and the same doctor, but it's all the details, everything under the hood. You've still got a Ferrari on the outside, but you've got a 1972 Pinto engine. So it's good to, sorry for the Pinto lovers out there, but yeah, you really need to check. So get with your insurance agent or broker and, check to see if there's anything better and how bad your particular plan has gotten. So if you need help, click that QR code, email me, and we can find someone to help you out if you don't already have someone. Can my husband draw on spousal benefits if I have not filed Social Security yet? He was told I have to be on Social Security too. That is correct. There was a law that was in effect a long time ago. It changed in 2016 where you could do that. One can file without essentially the other one receiving benefits, but they changed that in 2016. So you cannot file for benefits if this is your current spouse. Your current spouse has to start receiving benefits for you to file for spouse benefits. If it's an ex-spouse, they just need to be 62 years old. So as long as they're 62 years old, they don't have to have filed yet. Always impressed how smart you are. Yeah. The comment regarding the internal SS internal paperless system. I'm fooling y'all. I'm not that smart anyway. But anyway, the number one thing of knowing how smart you are is knowing how dumb you are. Yeah, it's Dunning-Kruger effect. The more you know, the more you know you don't know. Yeah, people are not very smart. They know everything because they don't know anything. Right? I'm 64 on SSDI. My ex is 56. We were married 10 plus years. I never remarried. We have one daughter on SSDI under myself. She has special needs. Can I draw off his Social Security? Yes, when he turns 62 years old. And he does not have to be receiving benefits on your record, on his record, for you to collect benefits on his record. People miss that, and Social Security employees miss that all the time, unfortunately. As long as he is 62 years old, then you can go ahead and you have to be 62, which you're already 62. But yes, and then remember, in soon your SSDI, once you hit your full retirement age, is going to switch to regular retirement benefits. It's the same amount of check and direct deposit. You won't even notice the switch. But no more CDRs, continuing disability reviews, no more work limitations. You can do whatever you want. Social Security doesn't care anymore once you hit your full retirement age. And your daughter, your daughter receiving disabled adult child benefits. So her benefits will continue as well, even when you're switched to regular retirement benefits. No effect whatsoever. And remember, when he starts collecting benefits, if his PIA, his primary insurance amount, is larger than yours, then you should switch your child to his benefits to get that more money. So she'll receive, just like she is now, 50% of your full benefit amount. If he files, then she will receive 50% of his full benefit amount. If he passes away, then it's 75%. So do I have to do anything if I want to keep the same Medicare supplement? Nope. That's the good thing about Medicare supplements. If you're happy with it and the prices aren't going up crazy, then yeah, Medicare supplements, unlike Medicare Advantage, you don't have to check every year to see if you're in the best plan. If you're in a plan N or a plan G and it's still a good price, then you keep that for the next 10, 20, 30, 40, 50, 100 years, whatever. So you don't have to mess with it. That's another great thing about Medicare supplements. Medicare Advantage, yeah, you really need to check it on a regular basis. But because you have a Medicare supplement, you also have a standalone Part D plan. So that's one thing you do need to check and Part D plans are really changing for 2025. So you need to check to make sure you're saving as much as you can on your prescription drugs. Sylvia, I need help finding a good medical plan. My benefits will end September 30th. I ended my job on September 1st and have Medicare Part A and Part B. Yep, click on that little thing and it opens up. You'll see my little link tree thing. It'll say one-on-one Medicare help. You click on that and you fill out the little thingy, and we'll find someone that can help you out and give you all your options, and obviously 100% free. Working disabled program. It says you need to be disabled even if you haven't got SSI or SSDI. It says you need to be deemed disabled by DDS. Who exactly is that? Yeah, DDS is the Disability Determination Service. That's the state agency that Social Security contracts with to make the medical determination. That was part of when disability started. They say, okay, the states wanted, anyway, part of the pie. So when you file for a disability, you go down to Social Security, you file for disability, they get everything together, and they send it up to the state DDS, Disability Determination Service. And those are the people that make the medical determination, get all your medical records, send you up for a consultative exam to see one of Social Security doctors and all that kind of good stuff. Yep. Let's see here. Besides Part B, what other rules apply to Medicare premiums that one has to pay? Are there others? Will be most likely. One of the other Part B is IRMA. If you are a high wage earner, then you might just pay a extra Part B premium, and that is basically the extra Part B premium based on your income from 2 years ago, wages, net income from business, 401k distributions, some other stuff as well. And so if you're if all of that totals, if you're single over 103,000, you're going to pay extra, more than the $174.70. If you're married, over $206,000. And if you have a life changing event, so let's say you earned, $300,000 2 years ago from work, and then signed up for Part B, but since then you've stopped working, then you don't have to pay that penalty. You just have to fill out a form. It's called an SSA 44, and tell them, hey, it's a life changing event, and you won't have to pay that extra premium. How does CalPERS work with Medicare? My husband is 63, retired from CDCR, Department of Corrections, but I'm turning 65 in February. So CalPERS, so possibly he did not pay into Social Security. He paid FICA, but he paid the Medicare part of FICA. So Medicare, same as everybody. But in terms of Social Security benefits, then his benefits are not going to be what it says on the ssa.gov website, because he is going to receive a non-covered pension. Cheryl, the longer you talk, the more I learn. Oh, wow, great. I appreciate it. My wife says the longer I talk, the more bored she gets. But anyway, so I like the learn part. Drew my second husband's Social Security when he passed. Took mine at 70. You said I could draw a first husband. Social Security tells me, no, I can't draw first. Social Security said, no, I married second before I was 60. Does first have to be twice Social Security? My second when he passed. So if you're receiving survivor benefits, so you're receiving survivor benefits. You didn't actually divorce or anything like that, so you're technically so. And your first benefit, your first husband's benefit amounts. Let's see, Social Security tells me I can't. So your first husband might still be alive and kicking, and if he is, then there's no extra benefits there anyway. First benefit has to be twice more. Yes, and survivor benefits are almost always more than living spouse benefits, because you get up to 100%. So that's probably why, because there's just no more money there available. You're technically entitled, but there's no more money there. All right. Next question is uses company names. I always try to avoid company names. I like to stay neutral. Can you change from yada yada Advantage plan to another company, or stay with the? Yeah, you can change. So you mentioned Advantage plans and then a supplement plans. You can change from most of the companies that do Medicare Advantage also have Medicare supplement plans. So you can choose, XYZ Medicare Advantage plan and switch to XYZ same company Medicare supplement plan, if you have a special enrollment period or you pass the health underwriting and all that extra stuff. So thank you so much for all you do. Yeah, I appreciate it. Well, I have to apply every year for the help and payment of my Part B premium. So you're getting help from your state Medicaid office to help pay for your Part B. You don't have to apply every year. Before I worked for Social Security, I worked for Department of Social Services doing Medicaid. But you don't have to apply every year, but you have to recertify probably every year, where they just check and say, hey, you didn't win $1 billion lottery or receive a few $1,000,000 from your long lost uncle, right? And you say, no, I'm not independently wealthy yet. And then they just continue your Medicaid, and then they continue paying for your Part B. So if a person applies for both SSDI and Social Security disability, you're probably talking about SSI and then SSDI. Be aware the SSI may give you free medical coverage from month you applied until the month you stop being eligible for SSI. Not from Medicare. They might do that when you're eligible for SSI. That usually makes you what they call categorically eligible for Medicaid. So if you're applied for SSI and you get SSI, then you go down to Medicaid and you apply for Medicaid, and they're usually approved. But once, if your SSDI kicks in and it's more than your SSI, then you'll lose your SSI and then also lose your Medicaid. So Deborah, I think, is right there. Yes. Hey, taken adult relative with Down syndrome, no longer able to work, sub minimum wage job. Work was only in government subsidized jobs. Disability. Why would she not be able to collect on her parents' Social Security record now? That's kind of yeah. Someone had this kind of question yesterday, and it sounded like they went way above the SGA, the substantial gainful activity. So that would prove that they weren't disabled before the age of 22. But there's a gray area in there. If someone didn't work above the SGA, the substantial gainful activity, for a relatively sustained period of time, then they can still get disabled adult child benefits. That is, they were disabled before the age of 22. So the case yesterday I was talking about, it seemed as though, yeah, they kicked themselves out because they worked quite a bit. But you work and be entitled to Social Security disability, because when you're young, you don't have to do the whole 10 years and stuff. It's only basically the minimum is 6 quarters of coverage. So some people work, they just work $500 a month for several months, and they get their 4 quarters, and then the next year they work $500 and they get another five quarters, and they're eligible for SSDI on their own record. But it's such a low amount, and they were in fact disabled before the age of 22. So file, because the calculations and what the SGA for that particular year was and all of it. Um, I would probably have that person, if obviously Down syndrome is something you get before the age of 22. So even if they are receiving SSDI, I would have them file and see if they're able to get disabled adult child benefits. What happens is they'll essentially get both. They'll continue to get their SSDI in their own record, two or three, four, $500, and then get up to 50 or get 50% of the parent's PIA, primary insurance amount, or 75% if it's a survivor claim. So yeah, in that case, I would probably have them file. But I think the case yesterday, if I read it correctly, yeah, they kind of kicked themselves out because of the substantial earnings for a long time. But I don't know the entire case that lady was yesterday. If I was married for over 10 years and divorced, would I still be entitled to my ex-spouse's Social Security if I got married after 60 years old? That's only for survivor benefits. If that person is alive and kicking, then you will not be eligible for benefits on that person's record. But you're eligible for survivor benefits if you remarried after 60 years old. In some states, there may main Medicaid 3 months before the date you applied for SSI. Yeah, each state is strange for Medicaid. I've had people that received Medicaid in one state because that particular state didn't count their Social Security disability benefits as income, and then they moved to another state, North Carolina. I'm looking at you, and North Carolina counts what they received from disability, and they lost their Medicaid. So yeah, Medicaid is a state federal partnership. It comes from federal money and state money, but the federal government, part of the whole federalism thing, allows the states to kind of write. There's general guidelines they have to follow, but yeah, they do things differently. Do you have to sign up for Part A and B, or can you refuse both if your check is not very much? The only way you can refuse Part A and still receive Social Security benefits is if you're paying a premium for Part A. So if you're not paying, if Part A is free for you, then the premium, then why would you refuse it? Because you're not losing anything. You're basically gaining something. But some people, because they didn't work enough and pay into Medicare enough, they have to pay a premium for Part A. And if that's the case, they can refuse it. All right. They need to make it so all of us can get supplemental plans. It just doesn't make sense to get an Advantage plan and you find later a hospital just dropped it. I agree with you 100%. I would go one step further and say, I don't think we should have Medicare supplement plans or Medicare Advantage plans or all that other kind of stuff. If you have Medicare Part A and Part B, instead of those six gaps, the 20%, the 1632 deductible, and all that, I think you just fill in all the gaps, add vision, dental, hearing, and prescription drugs, and call it a day, right? If they want to charge, Part D, premium, Part B, just like there's a Part B premium for Part D, then if everybody in the country has to pay it, then it's cheaper. The economies of scale. So, but that maybe one day. So I always say if I become a dictator for a day, that's the first thing I'd do. Well, right after the cure for male pattern baldness. But anyway, when I get Medicare at 65, I'm 63 and collecting early. How do I let Medicare know that I won't be able to pay for Part B, low income, and not have them charge me for that first payment? You're probably going to get charged that first payment, unfortunately. So, because what you do is you immediately go down, a month or two before you hit 65, go down to your Medicaid office, call them up, schedule an appointment, apply for Medicaid. And then what happens is the systems just take a month or two to talk to each other. So if they approve you for Medicaid and Medicaid says, yes, we'll pay for your Part B, then the system takes a month or two. So they'll take out $174 for a month or two, but they will return that money back to you once Medicaid pays for it. So high deductible G for the win. Yes, I don't talk about high deductibles enough, but yeah, I'm just, yeah, not a real big. They're good for some people. So there's G's and N's, and so G has like a high deductible, which cheaper in terms of your monthly premium, but it's a high deductible. So you have to pay several $1,000s before that essentially kicks in. So some people like those high deductibles. All right, let's make this the last question. We're over an hour here. Husband feels we should take my retirement at 63, but continue to work full time and take the penalty. Says we'll come out ahead in the end, even with the penalty for over the limit. Yeah, if you run the numbers, that's called kind of a split strategy. You take your benefits early, and I guess the higher wage earner, your husband, it sounds like, continues to wait until their full retirement age, and then once he files, then you can file a spouse claim on his account if his is twice your amount. So it doesn't matter how much you're reduced because of early retirement, because when he files, you're just going to be taken up to that full amount. And it sounds like you're talking also about the penalty. Some people do that as well. They say, stop my benefits. I can call and tell Social Security I'm going to be $1,000 over, and they can maybe stop it or maybe mess it up or whatever the case may be. Or I can just let it ride. And then when I do my taxes next year, the IRS will tell Social Security that I made $1,000 over, and they'll send me a nasty gram for you owe us $500, and we'll just pay the $500. So that's why there's a lot of overpayments out there, because people that's how they do it. Yeah. All right. We're over an hour, so I apologize if I didn't get to your questions. Make sure you join me tomorrow. I'll be back tomorrow, and we'll talk about whatever we're going to talk about. Yeah.